Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Cimetidine. The brand name is Tagamet. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. During this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Cimetidine. Then touch on 3 examples of dosing, and then finish it off with side effects. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Cimetidine is an H2 blocker that acts by inhibiting histamine action at the histamine H2 receptor of parietal cells. It inhibits both daytime and nocturnal basal gastric acid secretion, as well as gastric acid secretion stimulated by food, histamine, caffeine, and insulin. In terms of indications or reasons we would prescribe this medication to a patient, we may see this medication used in the treatment of an active gastric ulcer, as well as in erosive esophagitis. Patients with systemic mast cell disease may use Cimetidine, as well as patients who have an ulcer of the duodenum, whether it be active or just for maintenance therapy. Finally, patients with Zollinger-Ellenius syndrome would also use this medication. With respect to contraindications or reasons we would not be able to prescribe Cimetidine, there's really not that much to say here. This medication is pretty well tolerated, and the only contraindication would be if a patient had a hypersensitivity to Cimetidine or to any other component of the product. Now for some examples of dosing with Cimetidine. So in erosive esophagitis, we may see 1600 milligrams orally per day in 2 or 4 divided doses. For the treatment of an active gastric ulcer, we may see 800 milligrams orally at bedtime or 300 milligrams orally 4 times daily. In the treatment of systemic mast cell disease, we may see 300 milligrams orally 4 times daily, but higher doses and increased frequency may be necessary in some patients. The maximum dose would be 2400 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Cimetidine, so I'll go over some of those here now. As I said, this medication is very well tolerated, so there's not that many side effects to go over. The only one to really mention here of concern would be gynecomastia, which may happen up to 4%. Of course, gynecomastia would be the development of breasts. So in terms of serious side effects, now I don't have the percentages for these, but these would be rare. Gastric cancer, necrotizing enterocolitis in the fetus or newborn, pancreatitis, as well as psychotic disorder. Alright everybody, that's all we're going to talk about today with Cimetidine or Tagamet. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. Today, take care.